We will let people in as they join, but for the sake of time, I definitely want to get started. And the first question we have is from Lonnie Barnett, and his question is, what criteria is used to determine eligibility for the Vermont program? Who reviews and determines eligibility? And does the family have appeal rights? Are there any mechanisms to assure the program is utilized appropriately? Do any of our presenters want to take that one?
I think I'll take that one if that's appropriate. Yeah, thank you for that question, Lonnie. Again, I'm Adam Poulin. I'm the Clinical Services Director at CSHN, the Vermont Department of Health. So speaking about the Children's Personal Care Services COVID payment option that I presented on previously, eligibility for the Children's Personal Care Services benefit is determined by a registered nurse who is a part of the CSHN program here. Again, the personal care program is a collaboration between the Department of Health and Vermont Medicaid. So pre-COVID and throughout COVID, our clinical review team reviews the applications that are submitted by community partners, determines whether the service is medically necessary for the beneficiary, and then determines the level of service that's medically necessary to address their health condition. Any Medicaid decision that we issue comes with appeal rights that are pretty standardized across our Medicaid program. So I think the answer to that part of the question is yes. And then the mechanisms around like program integrity. So I'll speak a bit to that very quickly. And then it occurs to me that your question might be really specific to the COVID payment option, not to the Children's Personal Care Services Medicaid benefit in general. So there are several program integrity and quality assurance measures in place with the personal care benefit. We partner with a fiscal agent who, the state of Vermont partners with a fiscal agent that conducts some program integrity fraud prevention activities for us. And we collaborate with them, and we partner with our Assistant Attorney General's office to follow up on any concerns around fraud or misuse. One interesting aspect of the COVID payment for families enrolled with the personal care benefit is that this is a level of care that legally responsible adults are doing for their child, whether they can access the service through an external provider or not. And so it has created, and it's spurred this conversation now as we look at whether the state of Vermont will have this authority going forward through some global commitment to health negotiations with CMS. Essentially, how do we now relook at how things have gone over the last 2 years, and how do we feel good that kids are getting the medically necessary service, whether it's through a legally responsible adult doing it in some new type of under some new waiver authority, or in general through a personal care attendant hired by a parent, hired directly by a parent in a self-directed model. So I'll stop there. And happy to go further though.
Lonnie, did that answer your question? I know there were multiple parts to it. If there's anything you want to elaborate on, or if not, that's okay. Perfect, great. All right, so that was the only question we had in the question box, but I would encourage anybody, please put your questions in the chat, or feel free to unmute yourself, raise your hands if you want to. It's not required. I have all our presenters here to answer your questions. Or if our presenters have any questions that they would like feedback on, or to ask our attendees, you are also more than welcome to.
I'd be curious to know if any of the attendees came into the session with specific information they were seeking or hoping to hear that they didn't hear. And if we could maybe add additional content related to those areas.
Hey folks, so hi, I'm Elaine from Massachusetts, Title V, and I've got a couple of questions, and I did come in very much looking forward to hearing about the models that you have shared, and thinking about some of the models that we're considering as well at this moment. So, so I'll start with the child tax credit question, and with Isabel and from Colorado, and we have a public benefits and health policy specialist in the state. And this is a position that was a long-standing position for over 35 years, I believe, with a specialist who has recently retired. And her work that she had done, it was very direct, hands-on work with families, and also going out into the community and doing a lot of presentations to large groups, PACs, social workers at hospitals, different groups. And she has retired, and we are trying to think about the position in a more population health type of a frame, and technical assistance and training for our care coordinators to be the front line to take those questions and to kind of strengthen our capacity to serve with more people better versed in some of the more public benefits issues. And I was thinking that, I'd love to have her listen to this presentation, frankly, because I think we have a new hire who's going to, really be trying to think about policy, trying to think about partnerships, collaborations, and things like that. And the child tax credit and what you shared about how families could benefit from that, and how we could definitely publicize that and promote that in our state and get other partners at the table to do the same, I think would be very valuable. So that's one person that I'm thinking of in our team, and I'd love to hear any thoughts that you have about ways to convert, going from a very direct approach to more of this collaborative convening approach.
Yeah, thank you, Elaine, for the question. And this work can really be done at all levels. And certainly there's a place for direct contact and training of programs, helping programs get the word out in whatever way they have capacity for and that makes sense for them. And a lot of our work is helping program staff feel comfortable in talking about taxes and tax credit and economic mobility, understanding the why that it connects to health outcomes, understanding why public health, because we have the networks that already are reaching the populations that can benefit most, and then just cutting to some very simple what to say, how to refer. It's really just, do you have children? Do you file taxes? Are you getting these payments? Yes or no? And if no, connecting them to some very simple referral connections, codes or QR codes and things like that, and moving on, because most navigators don't have time or capacity to get much into the weeds, and they should not with tax code stuff because it's so individual for people. And then the opportunities, though, at a population level through state level partnerships, there's so many, and they're very exciting. We have a state agency work group in Colorado that is working with each state agency in different ways and programs for them. And CDHS, our Department of Human Services, is probably our strongest partner there, because they have, like us, they have many programs that reach people, Head Start, our county human services directors. We've done numerous trainings with them. And we see a spike in our metrics for our campaign every time we do that. Certainly, one surprise was partnering with state agencies and having them put something on their websites during tax season. People who are going to CDHS for benefits, people who are going to our Department of Labor and Employment for unemployment benefits, for example. There was a code right there saying, did you, very simple, did you get this money, $3,600 per child, kind of an eye-catching headline that they can then click through for more information if they need it. There's just so much overlap when we think of it as co-enrollment. So when people are doing outreach with WIC or SNAP or childcare subsidies, that they also mention tax credits and the opportunities there. There's so many exciting stories of families who make maybe around a $20,000 a year household income getting refunds of up to $10,000 and $15,000. The average refund is around $3,000. But there's lots of stories of people really stacking these credits up. And we have a recent tax rebate announced in Colorado just this week if people file their state taxes. So we'll be encouraging people to do that this summer, even though the tax deadline has passed. For people who don't normally file taxes because they don't make enough money to owe tax, they don't have a penalty for filing late. They can file all the way through mid-October. So there's a long promotion season, if you will, and really just a short break at the end of the year before we start back up in late January. So I just want to say one more part. There's so many partners where you have traction is sometimes where to go. Is it childcare? Is it CACFP? We saw a lot of traction there. WIC, sometimes at the local level, WIC directors want to work with us to promote it. Certainly at the state level, they got the word out through their social media and in their newsletters to WIC educators. And then Mile High United Way 211. If you have 211 in your state, we train all the call centers on all the new information as it comes out so that they can connect callers in need to free tax filing services. I'm going to stop there. Thank you for the question. I hope that helps, and I'm happy to talk more.
That helps a lot, and it gives me a real direction to go in. And I'll just say that internally, we have a lot of colleagues that are working on this as well. Last summer, we put a promotion for the child tax credit in our signature lines, on all of our emails and the website and all. But I love the idea of 211 and all the things that you said. So now I have a second question, and that's for Adam. And Adam, you've probably heard me talk about this before. I'm fascinated at what you've been able to accomplish working with your Medicaid program. And we are in communications right now with our state Medicaid program to look at the shift hopefully with the 1115 waiver in our state and creating an enhanced care coordination model through the accountable care organizations and a total care management model with providers who have expertise in medical complexity. And so we've been in communication with our Mass Health program and our colleagues there to think about how to align what we've been doing historically with enabling services for care coordination and shifting that to move some of the more direct enabling navigational care into the ACO and TCM is what it's called, total care management models.
Yeah.
And for us to take on more of a technical assistance and training role. And so, some of the comments that you made having to do with leveraging subject matter experts and having to do with a family directed model. And then of course, providing extra support through EPS, in alignment with EPS DT. So we're considering taking that kind of a role. And there's lots of opportunity, of course, in terms of bringing Title V topics into and trying to elevate the practice of care coordination so that it moves from a medical model and includes medical and social and, really trying to think more broadly. So I'd love to hear any advice that you might have for us.
Oh goodness, and it's good to see you, Elaine. I know we've kind of like brushed up against this topic in our regional call because we share a region, and so the first thoughts that came to mind in your really dense question, thorough question, move away from the children's personal care benefit into the care coordination medical social work program that Children with Special Health Needs has maintained in Vermont for several decades now. And, over the last 10 years, there's been a general shift away from, going family to family to family to taking stepping back, taking on a more consultative, really population oriented approach. And so I've been in this role since last September. I'd say like the last 3 folks in this role all, did their best to try and move the needle in that direction. Things become hyper-specific here. So the CSHN medical social work program was heavily involved in the COVID response for 2 years. And so there were 2 years where we were not available to our families in the typical way. And the silver lining, if we can really call it that, really a half full glass mentality, is that, the very bare bones, connecting families to care coordinators in their medical homes, in the regional designated human services agencies, and through specialty care clinics. That work really picked up steam, and it forced a different headset there. And so as our medical social work program was deactivated from the COVID response, we were very intentionally taking a different approach here. And so we've shifted towards tracking what our contact is like with families of medical complexity. In Vermont, scale, the difference in scale is absolutely, it counts in our favor here, because we have as many people in the state as many of you all do in a single county, right? Or half of a city. So we can track things with a team, a relatively lean team. And instead of going and doing direct family interactions, look for themes and resources that we're pushing, and build resources on our website and then push those out. We're also partnering with, it's the Vermont Child's Health Improvement Program, which is a collaboration with the UVM, Larner College of Medicine, and other folks at the University of Vermont. And their Children's Chronic Care Initiative team took on a project around care coordination. And so there's a care coordination, we started with a summit series where we pulled folks from all aspects of the system together. There were some really neat approaches of like breakout groups and identifying needs, what's working, what's not. We had family reps, we had direct care coordinators, nurses, physicians, administrators. And it's been a really, really agile, iterative process. Like, what feedback are we getting? How does that change? It was highly stressful in that regard, from like 1 week to the next, knowing you've got everyone's time you're trying to be precious with. But that project team is fantastic. And so from that work, we're shifting into more of a long-term care coordination coalition model of trying to engage with leadership at the accountable care organization, engage with in making sure that they are aware of this effort, of this work, and what the priorities are for families, for direct service care coordinators, leadership outreach to the major hospitals, to Vermont Medicaid. And while this is really real-time stuff that's like happening, as I speak here. And while this is happening, the CSHN program, the Title V program, is again looking at, we want to kind of be a foil to that work and understand like, where can we then support the network of care coordinators, in specialized medical complexity. Are there standardized models? There's a Compass tool that's being used to evaluate organizations' different, approach to care coordination, and then like set a measure and then track it every 6 months. Like, are they stratifying their population to identify, kids with the acute needs? Do they have family engagement and family voice built into their organizational structure, things like that? So awesome. That's okay, great.
Well, I really appreciate it. And I thank you both for your answers. Thank you.
Great, thank you. So we have a question from Karen in the chat. I'm a family navigator in Virginia and work to connect families with services and supports. The majority of my clients are low income. One big struggle is childcare. They can't afford private childcare. Head Start programs have long wait lists. Even getting childcare for other children when they need to bring a child with disability to appointments, the tax credits is great info. Any other suggestions or hints I can share with my families?
I'll start off responding to that. Some resources that I would suggest you reach out to there in Virginia would be your Office of Early Childhood Development. They should be able to provide you information on subsidized childcare available across the state of Virginia in different locales. Subsidized childcare can help offset the cost of childcare for those families that can't afford private childcare. It looks like Virginia also has an early childhood foundation, and they are working to provide affordable, quality, and equitable childcare for families regardless of income. So that would be another resource that you might reach out to help you identify those available resources that you can then, as a navigator, connect these families with. most states have a program called the Child Care Health Consultation Program. It is health specific to childcare, but it is many times administered through local public health agencies. So you also can refer clients to your local public health departments. I don't know off the top of my head how public health in Virginia is organized, whether it is centralized or decentralized, but the State Department of Health should also be able to provide you some, connections to resources and some information on how local public health works there in the state if you're not already familiar with that. But I think your early childhood educator, so the Office of Early Childhood there in Virginia, which I believe is housed at your Department of Education, should really have their finger on the pulse and really be that key one-stop shop that should be able to connect you to all those resources to help get families connected to affordable childcare. And then with regards to bringing children with disabilities to appointments, that's a challenge that I think every state has with regards to, number one, affordable transportation, number two, what do you do for those other children and so that you can take that one child. And there again, I think contacting your state Department of Social Services might help you identify some resources for respite childcare for your children that need childcare while you are taking your child, or while someone is taking their child with disabilities to an appointment, as well as there again, your Office of Childhood might be able to connect you with some respite childcare services as well. And others may have different ideas.
Thank you so much. So we already only have 3 minutes left. I can't believe how fast these discussions go, but in our final couple of minutes, do folks have any other questions for our presenters? Do our presenters have any final thoughts? And I want to make sure folks have plenty of time between sessions to transition and join our final plenary that is going to be absolutely incredible, infused with a lot of amazing youth voice. So with that, I will open it up in the last couple of minutes.
I'll say my thanks to Rebecca and my fellow panelists out loud then, not just in the chat.
Thank you so much, Adam. Yeah, it's really been a pleasure to collaborate with the three of you. And thank you all so much for coming and listening and for your great questions.
Great. And Rebecca did just put the email for the Catalyst Center in the chat, and the recording will be available on our conference website, as well as the materials that Rebecca uploaded. So if you joined late or you weren't able to watch the recording, please make sure to go back and do that. There was some great information. And thank you, everybody. We had such a great group, so much information, and we hope you enjoy the rest of the conference. Take care.